Hi, my name is Isabel, and this is Adult Gerontology 5120. We're going to do our physical assessment, check off, and history. This is Alexis. Do you agree to me videotaping you and turning it into the school?
Yes.
This is my student ID. Okay, do a clean sweep of the room. Every once in a while, you might hear my kids in the background. They're outside, but we're in the middle of a quarantine, so I can't really take them anywhere right now. But they should be good. These are the supplies. So I have gloves, tongue depressor, here's a pin, blank sheet of paper, tuning fork, ophthalmoscope, otoscope, the little things. We have the Rosenbaum, and then we have our hand sanitizer. Okay. Okay. All right. Hi, nice to meet you.
Hello.
My name is Isabel. I'm the nurse practitioner. I'm here to take care of you today. How are you feeling?
I'm good.
Okay. And what brings you in?
I just came in for a checkup.
For a checkup? Like a physical?
Yeah.
Okay. When was your last physical?
I don't remember.
You don't remember? Okay. When was your last office visit?
I don't.
You don't remember? Okay. Let's see. So, are you by any chance up to date on your immunizations?
Yes, I believe so.
You believe so? Okay. Have you had your flu shot this year?
Yes.
What about your Tdap or pertussis?
Yes.
You did? Okay. Do you remember when you had it?
In October.
In
when
October.
I had my son.
Okay, so when you had your son, that was probably your last visit in the office?
Yes.
Really nothing else other than your pregnancy visits?
Yeah.
Okay. Do you have any allergies? Do you have any allergies to medications, any allergies to food, latex, or even seasonal allergies?
Seasonal.
Seasonal? Okay, and what are you allergic to?
I think mostly oat, but I've never gotten tested for it.
Okay. Do you take any medications? Are you prescribed medications or take any over the counter?
I take some Claritin.
You take Claritin? Okay, for your allergies.
Yeah.
Nothing else?
No.
Okay. Any past illnesses or traumas?
I had asthma when I was little, and then I also had tubes in my ears when I was about 3.
Okay. Any hospitalizations?
Yes, I got my tonsils out.
Your tonsils out? Okay. About how old were you?
I think I was about 6.
6. Okay. Did you have any other hospital stays besides that?
No.
No? Let's see. So you had asthma as a child. So your asthma, did they ever tell you grew out of it, or did you?
Yeah,
have it
I
as
just
an
kind of
adult?
grew out of
You
it.
grew out of it, so you never had any issues
No.
other than that. Okay. Okay. Now, what about how do you feel today? Have you had any thoughts or plans for suicide?
No.
No. Okay. Do you feel okay emotionally?
Mm-hmm.
You feel good? Okay. As far as your skin, your hair, and your nails, any changes like hair loss?
I have a little bit of hair
A
loss.
little bit of hair loss. Is it just in one spot, or is it like a general? Your hair's missing in the shower.
It's just in about like 2 spots.
2 spots. Okay. And when did it start?
Right after I had the baby.
Okay. Sometimes it's normal for your hair, for you to lose some hair after the baby. You usually get a lot of new hair growth, but we'll take a look at that today. Okay. What about your skin? Any concerning moles? Any lesions? Any rashes?
No.
No? Okay. What about your nails? And are they brittle? Do you notice they're changing shape at all? Anything like that?
No, they're still pretty strong.
Okay. Now, how about your eyes? Any changes in your eyes? Any drainage, itching, redness?
No.
What about your ears? Any ringing in your ears? Any pain? Any drainage?
No.
What about your nose? Any drainage? Any do you feel like you're able to breathe, or is it clogged up or anything like that?
No, I feel fine.
Okay. How about your mouth? Any pain in your mouth? Any sores or any problems swallowing? Pain?
Yeah.
Okay. So let's move on to your lungs. So you said you had asthma as a kid. Right now, you have any problems?
No.
No. Do you have any shortness of breath?
No.
Okay. Your heart. Have you ever been told that you have an irregular heart rate, irregular rhythm, even high blood pressure, or no? Okay. What about your stomach? Do you have any stomach pain? Any diarrhea, nausea, vomiting?
No.
Okay. How about trouble urinating? Do you go really often? Can you hold it in? Do you have any problems with that?
No.
No? Okay. Do you have any, general just dizziness, any problems with balance, movement, gait?
No.
No. Do you have any musculoskeletal problems, like any problems with your bones, muscles, any abnormal,
No.
no injuries or anything like that?
No.
Okay. How about any like new bruising, any lumps, any swelling, especially in these areas, or tenderness?
Not that I feel.
Not that you felt, okay. Okay, now, who do you live with?
My husband.
Your husband, okay. Do you have any kids?
Just one.
Just one, okay, and how old?
Almost 6 months.
Almost 6 months, okay. Do you work?
No.
No? Okay, tell me a little bit about your diet. What do you usually eat?
I eat a lot of fast food and I snack a lot.
Alright. What about do you drink alcohol?
Yeah, every once in a while.
Every once in a while, just social, every now and then, or how many do you drink?
Probably like once a month.
Once a month, okay.
Other than that, it's just like sips. Here
Just
and there.
sips, okay. Do you smoke?
No.
Do you do any types of drugs or illegal substances? Okay. What about your family history? Your mom, is there any type of history with her?
I know she has high blood pressure and she's obese as well. And my dad is obese as well.
He's obese as well. Anybody in your family that has cancer?
My dad, yeah, he has bone cancer.
Your dad does?
Yes.
And do you know what it's called?
No.
No. Okay. All right. Let's see. So was there anything that brought you in that was a little concerning after all?
We had like a neighborhood like triage thing kind of set up, and they told me that it looked like I had high blood pressure.
Okay. Do you remember the reading?
No.
No. Okay. All right. Well, we'll check on that today. We did check your blood pressure before. It was a little bit elevated, so we'll look at when we do your physical assessment. We'll look more into that. Okay.
Okay.
So I'm gonna go ahead. Here a little later, I'm gonna ask you if you could remove your shirt. Is that okay?
Okay.
So I'm just gonna start. I'll sit down just for this part because it's our mental part. So can you give me your name,
Alexis.
your date of birth,
12/13/97.
where are you at right now?
The hospital.
The hospital. In what city?
San Antonio.
San Antonio. Okay. And what are you doing here?
Getting a physical.
Okay. So the patient is alert. She's oriented. Person, place, time, situation. She makes good eye contact with me. She's able to respond appropriately. She's in good spirits. She looks appropriate for her age. Her general appearance is good. I'm gonna move on to your hair. Okay, so I'm gonna take a look at your hair. I'm gonna actually touch you. Okay, let me get a little bit of the sanitizer before I do that. Okay, so I'm gonna take a look at your hair. I'm gonna look for any lesions, any lumps, any bumps, any type of infestations. A little bit of flaky. You just have a little bit of dry scalp. That's normal. Her hair is brown. It's soft. The texture is good. I can see a little bit of new hair growth. Is this where you said that you're losing a little bit of hair?
Yeah.
I can see some new hair growth, so it looks like it's coming back. But other than that, I don't really see any complete signs of alopecia, balding. So it looks good. Okay, I'm gonna take a look at your skin. So I'm gonna just put my hands on you, okay? It's warm. It's pretty tight. I don't see any type of skin breakdown, no rashes, no concerning moles. Okay, I'm actually gonna look at your nails. Okay, so checking your cap refill. Good cap refill, less than 3 seconds. I'm gonna actually compare your nail beds. Take a look at these nail beds. Okay, so the angle of the nail beds is less than 160. I don't see any signs of cyanosis, any clubbing. I don't see any problems whatsoever. We're gonna move on to her head. Okay, so I'm looking at her head. It's normal cephalic. I'm gonna actually put my hands on you again. I'm gonna feel the contours of her head. I don't feel any type of masses. I don't feel any bulging areas. I'm gonna move on to her neck, so I'm gonna take a look at her neck. Her neck looks nice, supple. I don't see any type of goiter or any type of masses to her neck. I'm gonna look to see if her trachea is midline, and it is. I'm gonna actually palpate the carotid pulse. Okay, other side, I'll do one side at a time. Okay, I'm gonna actually listen. So I didn't feel any thrills, so I'm gonna go ahead and auscultate. Good. It's a good strong pulse. It's not bounding in any way, and I don't hear any bruits. I'm gonna actually assess your thyroid. Okay, so I don't see any goiter like I said earlier. I'm gonna go ahead and feel from the back. Okay, here we go. I can feel it. I don't feel any type of lesions. I don't feel any goiters. It's smooth. Can you swallow for me? Okay, good. I'm actually going to listen to your thyroid as well. I'm gonna feel your sinuses. Okay, so we're gonna feel the frontal first. Any tenderness?
No.
How about in your maxillary sinuses?
No.
Okay. I'm gonna go ahead and feel your lymph nodes next. Okay, and I want you to tell me if you feel any tenderness. So we're gonna do the auricular.
No.
Sorry, the occipital. Do you have a hair tie? No. Okay. Sorry. Hold that up a little bit. Okay, so we're gonna do the preauricular. I don't feel any type of fixated. Postauricular. Tonsillar. Submandibular. Segmental. Supraclavicular. This might feel a little ticklish, okay?
Okay.
We'll do the axillary. Sorry, I feel right here. Okay. Same on the other side. Axillary. Okay. All right. I didn't feel any enlargement of the lymph nodes. I actually didn't really feel much of it at all, so that's okay. That's good. If we felt anything firm or fixated, we'd think maybe it was inflamed, and everything felt pretty good there. Okay. Next, we're gonna move on. I'm just gonna use a little bit of okay. So next, we're gonna actually look at your eyes. Okay. All right, so I'm gonna assess the outside of the eyes first. And I'm gonna look, lacrimal apparatus looks good. I don't see any type of crusting or any drainage. Sclera, white, her iris, lens clear, pupils round, equal, reactive. Okay. We're going to do, we're going to talk about what's called a Rosenbaum test. Now, we're going to have a card here, and I want you to read the smallest number that you can read.
Just like this?
Mm-hmm. So we're assessing your vision and what you can see close to you, okay?
Okay. 4 2 8 7 3 9.
Good. Okay, 20/40. All right. We would also do something called a Snellen test, and that one we'd assess to see how far you can see how your vision from far away is, okay? That one would be that one that's far away, the one that you see with the E's in the office, okay? Okay, we're gonna do what's called the red light reflex. Put this all the way to 0. Okay, so I'm gonna use my right hand to hold it, and I'm gonna look at her right eye. I'm gonna put my hand on her shoulder because I don't want to, just hit her as soon as I come close to her. So I'm gonna look in, and when I see a red light, I'm gonna follow it all the way in. I'm able to see her auricle. You okay? Okay, I didn't see any type of hemorrhages or any exudates. I'm gonna do the same, but this time I'm gonna hold, it with my left, when I look at her left, look for that red light. Follow it over. Okay. Same, I don't see any type of exudates, any, type of abnormalities, hemorrhages whatsoever. I'm gonna go ahead and I'm gonna shine the light right in the middle, and I'm gonna look at to see if the light shines in both pupils, and it does. I see bilaterally in both pupils. We're going to assess her direct and conceptual. So I'm gonna go ahead and I'm gonna look in your right eye, okay? We're gonna look here, and I'm gonna look at her pupils. And they constrict. Go ahead and look straight. They constrict. So that's direct. I'm gonna do it again in this eye, and I'm gonna this time looking at the other pupil, and that one constricts. So that's conceptual. So direct and conceptual. We're gonna do the same on the other side. So we're gonna look in this eye, and that eye reacts. And I'm gonna look in the opposite eye, and that reacts. So direct and conceptual. We're gonna actually do that actually tests our cranial nerves 2 and 3. We're gonna do the 6 fields of vision. You can follow my finger. Look this way, up, down to the middle, down this way, middle, this way, perfect. And that we assessed our cranial nerves 3, 4, and 6, okay? Since we're here, we should go ahead and assess cranial nerve 5. So what I'm gonna do is just put my hand here, open your jaw, close, okay? And then I want you to close your eyes. Tell me if you feel anything.
Yes, 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 yes.
Perfect. Alright, now we're gonna do your nose. Can you look up for me? Alright, I'm gonna look in. Okay, so it's pink, it's moist. I don't see any type of edema. I don't see any drainage. The other nostril. No drainage, is septum is intact. Can you close one nostril and breathe in? Out. Perfect. Close the other nostril, in and out. Good, patent nostrils. Okay, from here we're gonna actually do the ears. Okay, I'm gonna start by touching, okay? And I want you to tell me if you feel any type of pain or tenderness, okay? So a mastoid process. Any pain?
No.
Okay.
No.
Okay.
No.
I'm gonna touch her ear. Pin them. Or anything?
No.
About the other side.
No.
Okay, so I definitely want to do that before I put an otoscope in her ear because it would just hurt her if I put it in, and I want to brace her for that, and that would give me an indication that she had some type of infection. Okay, I'm gonna do what's called a whisper test. Okay, we're gonna test our cranial nerve 8. I'm gonna close this, and I'm gonna whisper a word in your ear, and I want you to repeat it. Okay.
Apple.
Perfect. Do the same.
Baseball.
Perfect. All right. You know what? Let's go ahead and do our other test. Let's do our Weber and Bryan test. So the first one, we're gonna do the Weber test. I'm gonna hit the tuning fork and it's gonna vibrate. I'm gonna put it right here, and I want you to tell me which ear you hear it the most in, or do you hear it equally in both? Okay.
Both.
Perfect. Okay. Now I'm gonna hit it, and I'm gonna put it right here, and I want you to tell me when the vibrating stops. Okay.
No.
Do you still hear it? Perfect. So air conduction is greater than bone conduction on this side.
No.
Do you still hear it? Perfect. So that's what we want. We want air conduction to always be greater than bone conduction. We're gonna move on, and I'm gonna take a look. I'm looking for my otoscope. There it is. So with an adult, we want to kind of pull up and back. Some cerebrum. I'm able to visualize her tympanic membrane. It's pearly gray. I can see the bony prominences. I'm sorry. Did that hurt?
Yeah.
I'm sorry. I was able to see there's no bulging. Let's take a look at this other one. I'm able to visualize the tympanic membrane, bony prominences. I don't see any type of erythema. I don't see any bulging. Looks good. Alright, next we're gonna move on to the mouth, okay? I'm gonna actually put my gloves on for this. Okay, first I'm gonna actually have you, I'm gonna take a look at the outside of your mouth, okay? I don't see any type of lesions. I don't see any skin breakdown. Her mouth is symmetrical. Can you smile for me? Frown? Puff up your mouth. Perfect. So, with all of that, we assessed her cranial nerve number 7, okay? And can you stick your tongue out and say, ah? Okay, now when you do that, I'm gonna go ahead and I'm gonna look in. Perfect. So she was able to stick her tongue out midline, and then whenever she said I was able to see her uvula go up. So those were our cranial nerves numbers 9 and 10. Okay. I'm gonna actually take a look. My tongue suppressor. It might make you gag a little bit, okay? Stick your tongue out. I'm going to inspect. So I'm gonna look. Buccal mucosa is pink. It's moist. Her tongue is a nice pink, moist color. It is, like I said, it was midline earlier, and it's appropriate for her size. It's not swollen, too big, too small in any way. Can you see her teeth? All right, she has 36 curly white teeth. I don't see any dental caries. Any problems with the gums? No lesions. Stick your tongue out again for me. Able to visualize. Her tonsils were removed as a child, so I can see that. Perfect. and then from here, we're gonna look at your chest. Okay, is there any way you can remove your shirt? Okay, so I'm gonna concentrate on her chest and her breathing. Now, her chest is symmetrical when she breathes. I don't see any accessory muscles being used when she breathes. I don't see any abnormal pulsations. I don't see any masses. I'm going to just assess. Nothing out of the ordinary here, okay? I'm gonna listen now, okay? Listen to your breath sounds. I'm gonna actually listen. Front, back, and sides, okay? Deep breath in and out. And out. Good. In and out. Good. In and out. Good. Tired from that baby, huh? In and out. Can you lift this arm for me? Can you turn so I can listen to your back? In and out. I'll just start with the back. I'm gonna actually percuss and I'm gonna hear a tympanic, a resonant sound. Okay. Can you lift your hand for me? Okay, I'll do the same on the opposite side. Okay. And while you're sitting up right here, I'm just gonna check for CBA tenderness. So if you can turn. If you want to, can you turn the rest of your body? It's kind of awkward right now, I know. Okay, I want you to tell me if you feel any type of pain, okay? Perfect. All right. So that was your chest. We're gonna move on to your heart. Okay. Oh. Okay, can you face the camera again? All right, so I'm gonna go ahead and I'm going to first, I'm gonna feel your pulse right here, okay? Dip your heart in. I'm gonna go ahead and listen. Now, earlier whenever I did her lung sounds, I didn't hear any adventitious lung sounds. I didn't hear any abnormalities after all, and I counted her respirations. I counted them for 30 seconds, or I counted them for 60 seconds, and it was about 16 respirations. So I'm moving on to the heart. So I'm gonna listen. It was a good, strong rate. In rhythm, it wasn't abnormal at all. I was able to count her pulse rate, and it was at about 66. I'm gonna go ahead, whenever I inspected here, I didn't see any abnormal pulsations. I didn't feel hear any bruise, and I didn't feel any thrills in that area. I'm gonna go ahead and start listening to heart sounds. We're gonna start with aortic. Pulmonic. Herb's point. Tricuspid. Mitral. Now, as far as the heart sounds, I heard normal S1, S2. I didn't hear any type of irregularities. I didn't hear any murmurs, any issues whatsoever. I would listen with her sitting down, laying down, and standing up, and I would use the diaphragm as well as the bell in my normal assessments. Now from here, I'm going to move on to her abdomen. Okay, can you lay down for me? I'm going to inspect first. I don't see any masses. I do see some striae. She just had a baby, so it's normal for her. I'm going to listen. I'm going to also take all 4 vowel sounds in her epigastric area. Normal vowel sounds. I'm going to percuss. So I'll hear all 4 quadrants and the epigastric area. Okay, so it's a tympanic noise. So I'm gonna go ahead and assess her liver. We're gonna move from low, move up until we hear a dole. There we go. Same on the left side, and this is going to be her spleen, so it's going to be mid-axillary. We're going to find the 12th rib, and we're going to move up to the 10th, right? Okay. We're going to do light palpation. I don't feel any type of masses. Do you have any tenderness?
No.
No. I don't feel anything out of the ordinary. We're going to do deep palpation. I don't feel any masses, anything irregular. Okay, thank you. In her abdomen, like I said, that was the only abnormality. She's warm, dry, and nothing abnormal about it, okay? We're gonna move on to musculoskeletal. You can sit up for me. Okay. Can you stand? Okay, can you just kind of walk back and forth? Okay, that's a good gait, good posture. Can you stand right here and bend over and touch your toes? Perfect, so I'm gonna look at the curvature of her back. I don't see any type, it's a good C. I don't see any type of curvature of her spine. It says symmetrical hips, shoulders, so no scoliosis. Okay, thank you. I'm also going to do our range of motion. Okay, so I want to do your cervical spine first. So can you look up, middle, down, up, side, side, front. I want you to touch with your ear, go down to ear, other side. Now do it with my hand pushing. Okay, perfect. So that's our passive range of motion. We're gonna do the same with your shoulders. Shrug up, down. Now with me. Perfect. Okay. And that, we assessed your cranial nerve. It's 11, okay? We're gonna go ahead and do the same with your wrist. Okay, go up, down, up, push down, push up. Perfect, okay, if you wanna have a seat, do the same with your ankles, push down, up, down. Perfect, okay. All right, we're going to do your reflexes. All right, so we're gonna do the patella reflex. You might have to sit for that. Okay, just kind of, you can just relax. Okay. You have a little scar telling you where to go. Your brachial. To kind of, hold, let me see, right there. Okay, same thing on the other side. Okay, we're gonna do right there. Oh, sorry. Alright, same thing on the other side. Okay. Alright. Next, what we're gonna do is we're gonna feel your pulses, okay? Temporal. Okay, brachial. Can you see? Sorry. Radial. Dorsalis, pedis, tops of the feet, posterior tibia. Okay. All right, now we're gonna do our neuro part of the exam too, where we do your rhythmic motions. Okay, so I want you to hit your knee, hit your legs down, come up, flip, down, up, flip, down, and do that over again. Perfect. Okay, now I want you to put one finger on your nose. Now touch my finger. Back to your nose. Okay. Perfect. Perfect. Okay, and now we're going to assess your function. So I want you to close your eyes and tell me if you feel.
Yes. 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 Yes.
So some bony prominence?
Yes. 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 Yes.
Sorry. And now we're going to do it with, tell me if you feel.
Yes.
With the vibration.
Yes. 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 Yes.
Okay, and I think that's about it. So that concludes our physical assessment today. Now, do you have any questions about what we did today?
No.
Okay, and you did have a little bit of blood pressure issues. What we're gonna do is we're gonna go ahead and recheck your blood pressure. Okay. If it is still high, we might start you on medication today. Okay. And if we do start you on medication, I want to see you back in 2 weeks, just so we can see how you're doing with the medication.
Okay.
If not, we'll go ahead and we'll see you. You know, I want you to go ahead and keep your annual checkups. It's very important for you to come every year and for you to get that flu shot every year as well. Okay.
Okay.
It was very nice to meet you.
Thank you.